Participatient, כל מה שחשוב לדעת על שיתוף מטופלים לשינוי מערכת הבריאות.
ערב טוב, אורי.
ערב טוב, ליאת, מה שלומך?
בסדר גמור, מה שלומך?
בסדר גמור, אני קצת מתרגש, היום יום מיוחד כזה.
לא קצת, ממש. אנחנו בספיישל אפיסוד.
ממש, בפרק מיוחד עם אישה מעוררת השראה, ואחת מהמובילות של המהפכה של שיתוף מטופלים במערכת הבריאות. סוזנה פוקס, היא מארצות הברית.
ולכן אנחנו תכף עוברים לאנגלית, אתם לא מאמינים.
אנחנו נעבור לאנגלית, זה פרק שהתנהל באנגלית, וזה גם משמח קצת. וסוזנה ניהלה את תחום הבריאות במכון המחקר פיו, ואחראית על כמה מהנתונים הראשונים בעולם על שימוש של מטופלים במדיה דיגיטלית לצורך הבריאות של עצמם. אחרי זה עשתה עוד מלא דברים, בין היתר שירתה לדעתי כמנהלת הטכנולוגיות במשרד הבריאות האמריקאי.
שנעבור לסוזנה וניתן לה להציג את עצמה.
וכזה...
היי סוזנה.
היי סוזנה.
And from now on in English, you won't hear the gibberish of Hebrew anymore.
It's beautiful. I love listening to it.
Thank you. And thank you for joining us today. We said that it's a very special episode for us. And we are very happy to meet with you in general and to talk about patient empowerment and all the stuff that you do. Uri?
Can you introduce yourself shortly, like big steps in your career and what's your passion when we talk about patient participation and healthcare?
Sure. I describe myself as an internet geologist. I look for patterns in the landscape of technology so that I can help people navigate and build things that are useful on this ever-changing landscape. In my early part of my career, I built websites. I fell in love with the possibility of democratizing access to data and information and shifting the power structures. And I brought that to my work in healthcare. I think the internet and technology is a wonderful way to shift the power structure so that patients and survivors and caregivers can participate fully in healthcare.
And I think the reason that you are here today is because there is a new book. You said childbirth, so book birth. It calls Rebel Health. And you describe in the book the revolution of healthcare and patient-led revolution. And I think the first question that I want to ask is why a book? You talk about the digital world and I bought it on Amazon. I really like in years before book with a paper and all, not a website, not anything like that. So why you chose to do a book and not anything else?
Well, you have a lot of choices. When you have something that you want to express to the world, you could write a song, you could start a company, you could write a book, you could have a podcast. And I chose to write a book because I had 20 years worth of research, my own research as well as other people's research from the academic world, that I wanted to bring together into one place. And I got very good advice from some mentors who said, very kindly, people may or may not read your book, but they will invite you to give speeches on bigger stages and on interesting podcasts if you actually publish this book. So the book is a way to bring my evidence all into one place and give lovely people like you an excuse to ask me about the patient-led revolution. But I also want to say, I designed the book for two different audiences. And that is people who are not feeling well, people who may be very tired because they're caring for a loved one, or they're going through a treatment that is exhausting. And I also designed it for very busy executives of healthcare companies and startup companies who also might be exhausted. Yeah. And so I made sure that there's lots of illustrations, lots of engaging examples, summary boxes at the end of each chapter. And so I actually approached designing my book like I would design a website.
Yeah, it's very easy to read, and I recommend everyone to read the book because it gives you, I think, the map to really rebel the health system. And that's why Uri and I are doing the podcast. We are not going to do maybe a big revolution, but our revolution is...
Trying to take the ideas into the Israeli healthcare ecosystem is something that I've been doing for a while, and Liat also. And I wanted to ask you in this sense, within the book itself, you paint a matrix. You call it the Rebel Health Matrix. It's a podcast, so it's hard to understand, but a matrix is basically a four-part diagram, right? Can you a little bit explain how you came about to think in that way, and what does each quadrant of the matrix means? And I know things can move from everywhere to everywhere, so it's not a one-sided matrix, like there's not just one way to go through that. But if you can give us a little bit, because I think it's one of the main ideas of the book is the matrix.
Thank you so much for asking about it. It is a visual. So let me describe the visual and why I created it. Imagine in your mind's eye a horizontal line. So this is the x-axis. And on one side, you can group all of the healthcare challenges and conditions where people's needs are not being met. And what's very important is that people themselves get to decide whether their needs are being met. And on the other side of that horizontal line are healthcare challenges where people's needs are being met. It's very clear that there's a diagnosis, there's a treatment, people understand the treatment, they can afford the treatment. And then dividing that line, the y-axis, the vertical axis, at the very top of that line, you can group all of the healthcare challenges and conditions that are visible to the mainstream healthcare system. And then at the bottom, there are all those challenges and conditions that are invisible. I created this to help activists understand where their challenge falls, and therefore what kind of tactics and strategies they need to get to what I think of as the upper right quadrant, which is where the needs are being met and they're visible to the mainstream healthcare system. I also wrote it because I started out my career as a researcher and spent a lot of time doing field work like an anthropologist in communities of people living with life-changing, rare diagnoses who find themselves in that lower left quadrant where they're invisible and their needs are not being met. And then as my career progressed and I got invited into conversations at our National Institutes of Health, I was invited to work at the Robert Wood Johnson Foundation, the largest healthcare philanthropy in the world. And then, amazingly, I had the honor of working in the Obama administration at the U.S. Department of Health and Human Services as the Chief Technology Officer. In each of those situations, I found that policymakers and even fellow researchers who hadn't had the privilege of spending time in communities, they didn't understand how much suffering there was that was invisible to mainstream healthcare. And so I realized I needed a way to express that. I needed a way for people to see how much suffering there was underneath the surface of mainstream healthcare.
Yeah, we talk about it a lot in our podcast about the places that the healthcare system can't see. You talked about communities, and you talk about in your book a lot about communities. Can you give an example from your book to a community that the suffering wasn't showing, but they took the power and changed their lives?
One of my favorite examples is people who are living with insulin-requiring diabetes or type 1 diabetes, which to the outsider would look like something that is visible and people's needs are being met. It's a very clear diagnosis, and there's insulin, and in the last 15 years, there's been wonderful devices brought to the market like continuous glucose monitors and insulin pumps. But anybody who actually lives with this disease knows that it's life-limiting, especially if you are caring for a child with type 1 diabetes. Parents actually set alarms throughout the night. They stumble down the hallway to their child's room every 2 hours to test their blood sugar or to look at the continuous glucose monitor screen in the dark, hoping not to wake their child, but to make sure that their blood sugar is stable, that it's not going low in the middle of the night. And this is a community that was very frustrated that they didn't have access to the data generated by the continuous glucose monitor. I'll call it a CGM from now on.
Mm-hmm.
And so one day there was a dad in upstate New York who was he's an engineer, and he looked at his son's CGM. His son was 4 years old at the time. And he realized, I think I can actually break into this and get the data out. And so he did. And he shared what he did on Twitter. And that day, hundreds of people all across the world were able to replicate what John Kostick did and send the data to their Apple Watch. That's what he was using. And that set off a cascade of innovation. And here we need to think about how there was already a community online. It was mostly on Twitter, but also on Facebook, where people living with type 1 diabetes had gathered together to define the problems that they were all experiencing, so that then when someone I call a solver came into that group of networkers and said, actually, I think I can, what the networkers then were able to do was spread this innovation, which then got the attention, as you might imagine, of the device companies and of the FDA, the Food and Drug Administration here in the US. And at first, people were pretty taken aback that patients and caregivers had essentially been able to jailbreak a medical device.
Hack the device, yeah.
I remember the discussion, and I also remember there's a loophole in the FDA mandate where if it's not commercially intended, they cannot do anything about it. Maybe frown, but not more than frown, right?
And that's the key. And that's a really, really important loophole to the patient-led, survivor-led, caregiver-led revolution in medical care, because it means that the FDA can provide regulatory advice, and it also does not play the role of a police officer in the medical device innovation space. The medical device company said, hey, wait a minute, you have to stop these patients from doing this. And the FDA took a look at it and said, actually, what they're doing is good for their healthcare. They're actually able to better manage their own diabetes or that of their child. So we're not going to stand in the way. We're actually going to help the patients. We're going to figure out how to actually build this into our requirements. And that's an example of what I call the full stack of the patient-led revolution, where people are able to move from that lower left quadrant where their needs were invisible to mainstream healthcare, and they're able to move at least to where some people's needs are being met. And then when the medical device companies started creating products that are mainstream, that don't require people to hack into their own devices, that's when we're starting to move into that upper right quadrant where it's
that's
visible.
very interesting. I was part of a community of juvenile diabetes parents, and I remember that they were talking about giving extra sugar for their kids at night, which is not healthy for them because you don't want higher blood sugar levels. But they were better with that than getting a hypoglycemic child when they're asleep, and that could mean death, right? If it's untreated. So I remember parents doing that, knowing they are minimally harming their kids just because they want to be sure it doesn't happen. So this hack is so important, and making it into, I think last year, right, an FDA-approved platform is an amazing story. It also reminds me of a story of another great activist, Hugo Campos, where he has his heart condition, and he was fighting his, I don't remember the name now.
The ICD, the maker of the implantable cardiac
device. Yeah, he was fighting them tooth and nails to get the data out of that, because he's saying, it's my heart, it's my data, and they didn't give him. And I remember he was also fighting on Twitter with one of the executives, like showing him, if you remember, there was a little bit storm around it where he showed him that he would like to have the data, right? And it's the same for him. And I think that was one of the breakthroughs for him to get the data. How easy is it become along the years for patients to get their data, do you think?
Diabetes stands alone. So diabetes stands alone still as a group of people who are able to demand and get access to their device data. Hugo still does not have sanctioned access to his data. He is such an extraordinary person that he actually went to school. He traveled from San Francisco to South Carolina to learn how to be a technician so that he could tune his own cardiac device and figure out how to get, and therefore invest that time personally in understanding how to do it. The problem is that medical device companies traditionally see their customers as the doctors who prescribe the devices. These device companies don't traditionally see the patients or caregivers as their customers. And so they don't serve the patients and caregivers, they serve the doctors. And that's still the case in every other sector of device data. And so what I urge people to do is look to the diabetes online community as a model for what could be the answer to change in the industry.
And you talked about networkers, solvers. So for those who didn't read the book, and maybe you can start with Hugo and give him the type. You have 4 types of kind of revolutionaries or patient activists. Can you talk through the types like you talked through the matrix?
Sure. Yeah, sure. And I want to say that I based these archetypes on 20 years worth of field notes. As I was writing the book, I went back into my notes and I noticed that there were patterns in the way that people respond to a challenge. And you could be all 4, you could be just one, or you could say, I don't have the skills or the time to be any of these. I'm going to recruit them to my team. So the one way that people respond to a healthcare challenge is when they are not getting the information they need. They may not have a diagnosis. They just aren't getting the answers. And so they go out on the hunt and they become what I call seekers. And the main thing to know about seekers is that they do not give up. The second group,
everyone needs to know that they don't give up.
They will not stop. They will sneak under barriers, jump over barriers, go around barriers. They'll get what they need. If they have to steal it, they will. Networkers are people who form communities. They're the types of people that you'll see in your offline community who are organizing your neighbors to take action. They're the people who are starting Facebook groups or a hashtag on social media. They're gathering community and they pool resources and they learn in community. They're very, very powerful. And it's actually what most people think of when I start talking about e-patients and participatory patients. People say, oh, I know what you mean. It's the Facebook people. Yes, but that's only one of the 4 groups, networkers. The third group are solvers. Solvers are people who, if they encounter something that is not working, they want to take it apart and put it back together again. They want to look at a medical device. They want to break it down. They're also inventors. People living with disability are often solvers. They have to invent some way to navigate the world with maybe low vision or a dexterity challenge. A solver can also look at a system and see ways to improve it. The fourth group emerged as I was doing my interviews with e-patients and caregivers and survivors, talking to them about their journey through taking something to market or being successful in changing a regulatory structure. Each person who was successful pointed to people who had access to power, who shared it with the patient-led group. And so I came up with the name champions. Champions are people who have access to funding. They might be able to give regulatory advice. They might have access to labs or manufacturing facilities or special materials. A champion could also be a journalist, someone who's able to shine the very bright spotlight of mainstream attention on a problem. And that can be a powerful way for a caregiver-led, survivor-led, or patient-led team to scale up.
You need all four of typecasts to make a revolution go well, or you can do it alone. If I'm a seeker, I can do a seeker's revolution.
It depends on the problem that you're trying to solve. If you are an individual who feels that you're not getting answers, you can become a seeker. And if you are lucky, you actually might find that there is a solution. There is a way to describe your symptoms so that a doctor can hear you and give you the diagnosis and treatment that you need. So it might be just a case of there is a solution out there and you just don't know about it yet. And one of the reasons I wrote my book is actually to make sure that everyone understands that you are not alone. There are people who would love to help you if only they knew how to find you. And it takes courage to ask for help. It takes courage to admit that you don't know the answer. And that's where seekers and networkers can gather around someone and lift them up and get them what they need.
I want to emphasize what you said about how you tell your story. You talk about it right at the beginning of the book. I think many times patients don't know how to tell their story to the doctor they are seeing or even to a fellow patient. And that's why they can't find the answers. So if you can, just in a minute, explain to people how they should tell their story so everyone really can hear them and try to help them.
The most important thing to do is pay attention to your own body. You know your body. You know what's right and what's wrong. Take notes, take detailed notes. And if you're not sure that you have the words to describe what's going on, you can join a Facebook group. You can go online and read articles. You could read someone's blog. You might find someone who has some similar constellation of symptoms who has a podcast. Listen to that podcast and gather the language that you need. Instagram is also a great way to do searches for different types of patients. This is what's awesome about social media, because it just removes the barriers of time and space so that people can learn what language they need to talk with doctors so that they can be heard.
I wanted to ask, what are your safeguards when you do that? How do you kind of know how to steer what is a language or what you should listen to and what you shouldn't? I know there are areas that are more prone to, let's say, fake news or misinformation, but it's always a question. I think always in the overall, it's a positive net if you do that, but everyone, develops their own system of how do I double check the facts to see that the information I gathered is helpful, truthful, makes sense?
Such a good question. Thank you for asking. Again, the first thing is the truth of your own experience. So first, listen to your own body, track your own symptoms. Then, if you're going to get social around your health, you're going to get social, but you're also going to consult with a doctor or other clinician. What you're doing by going online is gathering resources, multiple resources, not just one, that can help you better understand what's important as you're sorting through the symptoms that you are observing about yourself. Make sure that if you are going into an online community, make sure that it's a very active community, that there are lots of posts every day from lots of different kinds of people. Studies have shown that a healthy, vibrant, active online community almost has antibodies against false information, misinformation. If it's an active community and someone posts something that's incorrect, studies show that it's likely to be downvoted. It's likely to have comments attached to it that say, no, this isn't right. And so be very careful about that. Also, it's a good idea to fact check against, if you can, fact check of what you find against the academic literature. The National Library of Medicine here in the US has this wonderful resource, PubMed, where you can search online and at least get abstracts, if not the full text, of medical journal articles. And, it's not perfect. There's actually misinformation that can be published in academic journals, but it's another source that you should definitely be aware of. But in the end, consult your doctor. All the people that I talk about in my book are pro-social, not anti-science.
Yeah. Thanks. That's really good tips. I also want to talk about those archetypes, because you talk about these archetypes in patient. And when I was reading the book, I was thinking those are actually the archetypes of a good team wherever you are. Like if you work in a healthcare institution, those are the people you're looking in to break into innovation, to do new stuff. It's like archetypes for general innovation. It's not just patient-led revolution, right? It's more general than this in some ways.
Yeah, I hope so. My focus for the last 20 years has been on healthcare, but I'm really interested in innovation of all kinds, product design, and I looked to the innovation scholarship to make sure that I was placing my archetypes and the Rebel Health Matrix in the context of other scholarship related to product innovation. And there's some really wonderful similarities in how work gets done. And, there was some great work that was being done in Austria and Germany around two scholars who looked at innovation in the design of kayaks. And I was really inspired by that, because actually one thing that they found is how important it is to be part of a community. If you're redesigning these kayaks, then you should be part of a community of kayakers. And that's how I feel about medical and assistive devices. It shouldn't be people who are creating these who aren't using them. Of course, you should have patients on the team. If you are building a medical device to serve people with sleep apnea, well, you should have people who live with sleep apnea on the design team.
When you say it sounds very easy, but we all know that it's not. It's not like that. When in the medical device and pharmaceutical companies, patients are not a part of the process. They are starting maybe in some places. I wanted to ask if you think the revolution has to come from outside, from the patients, and not from inside, from the organizations. Because if the organization won't change, we can scream as much as we want, but the devices, the medicine will still be the same.
I think it has to come from both inside and outside. And one of the messages that I'm hoping to bring to healthcare is that the patient-led revolution is going to be a competitive advantage. It's a wave that is unstoppable. I like to say that I am an ambassador from the future, and I've come back to tell you what's going to happen. And why not take advantage? Why not start to design the work that you do to include patients and stay ahead of your competitors by doing so? And even if it hasn't been done that way before, why not be the first in your sector to make sure that you have not just one patient, but multiple patients on the design team, helping you, for example, to design clinical trials that people will actually want to be part of. And therefore, it'll be easier to recruit and keep people in those clinical trials, and you'll get your drug to market faster than any of your competitors.
Can I challenge you to be a little bit more specific? Like we work in healthcare for years, and in large organizations, it's hard. First of all, a lot of the patient, let's say, participation that is going on is mostly around service design or service satisfaction, which is important on its own, right? I'm not derogating from it.
It's a good start.
It's a great start because it's really important. Sometimes it's even more important than the actual clinical stuff. If you get a good smile from your doctor or a good word, it has a therapeutic effect anyway. But how do you bring it into the more, let's say, hardcore healthcare decisions or healthcare innovation ecosystem, which is large? It's startups. Some of them are led by patients or caregivers. But it's also huge organizations like hospitals, care systems. You worked at the HHS. I mean, how do you start to do that? In two ways, I have a challenge for you. One is explain the value inside the organization and why should we really do that? What would be the value? The second is, how do you work with patients not having too much expectations, because then a lot of it is bound to fail, and sometimes you get out of these sessions and out of this and everybody is bummed out because we talked a lot, but it's really hard to make the change really happen, right? It's a 99% failure rate in some ways.
As are most startups, yes.
Yeah.
And if patients are involved, it feels like it was a systemic failure for the patients, when in fact it's just a typical experience for a startup company. I love these questions. And indeed, a lot of the insight that I bring related to the very conservative nature of healthcare is from my experience in the federal government, as well as helping to consult with some large legacy companies in healthcare. We do not want to move fast and break things in innovation in healthcare. We might want to move slowly and carefully. And yet there are opportunities to create what I like to think of as an intake valve for patient insights. One way that we did that at the U.S. Department of Health and Human Services was to sponsor prize competitions. There are so often business challenges that a company or a government agency realizes that they don't have the expertise in-house to solve that problem. They can define the problem, but they actually don't know how to solve it. And that is the perfect opportunity for something called a prize competition, where you create a prize purse, you create some money and it doesn't even have to be that much money. And you describe very clearly in public this discrete challenge that you face. And then you open it up to all kinds of people to solve it. One way that you can bring patient insights is to actually require that all teams have someone with lived experience on the team in order to compete for the prize money. And this has been very successful in all kinds of domains. In the U.S. government, NASA is the greatest customer for the prize competitions. They've had incredible success, but the U.S. Department of Health and Human Services has done this as well. The reason why you should do it is to show executives that there are great ideas outside the company that they can tap into. What I found in my work while I was at HHS is that it actually wasn't very difficult to convince the top level executives that a prize competition or bringing in patient insights was a good idea. It also wasn't very difficult to convince the people who work on the front lines of healthcare, people who, for example, are nurses or work in hospitals on the front lines in patient care. They see every day that patients and caregivers have great ideas. The danger zone is what I like to call the permafrost of middle management. These are people who have worked their way up in a bureaucracy of a large company or a government agency. They have won the game as it's being played now. And they feel very uncomfortable if people are asked to change the rules of the game. What you need to do is show them that it's going to be to their advantage to let the people who work for them on the front lines have some more autonomy and have some ways to contribute to being part of a prize competition, for example. And executives can help in this project of getting the permafrost of the middle management to be part of this by actually making it part of their annual review. And to ask the middle management people, how have you included people with lived experience in the work that you do this past year? And to actually make it part of how people are evaluated. That's what I'd like to see in the future, because there is so much good that can happen because of this. That's what I think a forward-leaning company could do.
It sounds like a great plan, but I can hear in my head all the bureaucracy and people are saying, no, it's okay how we do it right now. It's okay. Let's stay safe.
It makes a lot of sense, but you probably know it's not an easy journey, right? Also, I wanted to ask, I think in this patient-led revolution, online communities were a breakthrough. And I think they're also like an untapped resource in terms of for institutions, for government, for large companies to tap and listen where it's legal and it's fine and it's known, like Twitter or whatever, where it's public. Do you see that also? Do you think like the idea that everything is now documented, as you said, barriers of time and space have been lifted? Do they listen? Do some of these organizations need to listen what's happening in their patient communities?
I think they would do well to listen. I'll loop back to the diabetes community, where device companies and the American Diabetes Association and clinical groups did not see the patients coming. And patients were essentially able to sneak in the back door and start coming to conferences and start asking questions. And as it turns out, all of those patient activists who had gathered together online realized that they are not alone. They're not the only person that's struggling. And the strength of the online community, understanding that they're all experiencing this problem together, gave them the courage to start to go to medical conferences and start to ask questions of the FDA and of medical device companies. And what I'm happy to say is that the success of some companies is now becoming clear because they are listening to patients. Again, look at the diabetes space and see how innovation has spread in the last 10 years because of the spark of patient online communities of people living with diabetes. That's something that we can take inspiration from. And again, if you are an executive at a pharmaceutical company, if you are an executive at a device company, now is the time to start listening to patients. And I love that you brought up in public ways, let's look at Reddit, let's look at Twitter, let's look at Amazon reviews. There is so much great stuff in Amazon reviews where people are giving very clear feedback about the products that they're buying in the medical space. And are executives listening? I sure hope so.
I'm not so sure. But I wanted to add, and that's the word, I wanted to add to Uri's questions about online communities. You talk a lot in the book about, I forgot the word, מחלות נדירות.
Rare disease.
Rare disease. Thank you.
Yes.
Yeah, and the online community and how it gave them the empowerment to treat themselves, to know that you are not alone. So I would like you to give us a small example, because you have great examples on the book, and also maybe give some tips to people that live with rare disease.
Thank you for asking. People living with rare diseases are actually a continual source of inspiration. I got advice early in my career to go and hang out with the rebels and the pioneers on the frontiers of healthcare. And that really is people living with rare disease. In the US, that's defined as people who have a disease that fewer than 200,000 are diagnosed. And Rare Disease Day is February 29th, Leap Day every year. One of my favorite examples is a man named Burt Minow, who was born in 1929 with full facial paralysis. And at that time in the US, his parents were advised to put him in an institution and forget about him. It's something that happened to many, many people, that if they were different, they were put away. And his parents said, no, we are going to keep him home. And he didn't have a diagnosis until he was in his 60s. And it is Mobius syndrome. And it's a paralysis of the 6th and 7th cranial nerves, full facial paralysis. So it just looks like you're talking to someone who is a master ventriloquist. His niece was able to test early search engines and found an online community of other people worldwide who have children with Mobius syndrome. It's about 1 in a million across the world. And she wrote to them and said, oh, my uncle has Mobius syndrome. And they wrote back immediately and said, how old is he? And she said, oh, he's in his 70s. Well, at that time, the published medical literature said that people with Mobius only lived into their 30s because that's all they had on record. And so that day, across the world, people found out that their children would likely live a typical lifespan.
Yeah, and I think it's empowerment. It's not only technological innovation is patient empowerment or patient revolution.
No, the actual community.
Yeah, the actual community, the actual knowledge. They know now that their children will have a meaningful life, a long life. It's empowering.
Exactly right. And there are so many examples like that where sometimes there is a way that you can work towards a treatment or a cure, and sometimes it's enough to know that you are not alone.
Yeah,
I think it's different kinds of needs. I mean, actually, just validating that you're not crazy is just, and you're not alone is just a very healing power. It doesn't matter if you have, a treatment for your disease or not. Just knowing that you're not crazy the way you think or the way you experience the world is something very empowering, and saying, okay, it's not just me. I had it with my son the other day, actually, where I told him I was scared also of something, and told him it feels weird in the tummy when you're scared sometimes. And he said, really? With you too? Like, he didn't know people felt this way. He didn't think about it. And just from listening and understanding that it happens to his father or to other people, he felt more aligned with the world. He says, okay, I'm not weird. He's 11 years old, so but it's fascinating how validation can help just by knowing you're not alone.
Exactly right.
So I'm asking you for tips. If you are someone who hears us and dealing with a rare disease, what do you tell him? What he should do to not feel alone, to feel empowered?
Well, there are wonderful organizations. One that I know of is Global Genes. Another is in the US is the National Organization of Rare Disorders. And they have a clearinghouse of people who are gathering together. They have a clearinghouse of online communities of people living with rare diseases. If you don't yet have a diagnosis, it's again very important to collect all of your symptoms. Don't ignore anything. And see if you can align yourself with an organization or a community that has something similar, because it's often people who have something similar who can pass you along to the next guidepost and help you get toward the community that you really need to be part of. And again, if this sounds overwhelming to you, you don't have to become a networker. You could ask someone in your friend group. Maybe there's a family member who's a very natural networker who knows that you're suffering and wants to help. You can give that person all of the information and they can go out and join a community on your behalf.
I think it's really, really great advice to be somewhere and they will forward you to the next place.
So I think we had a very nice discussion and we're kind of nearing the end. So can you tell the public where they can get your book and how?
Sure. So it was published by MIT Press and it is available as an audiobook, a digital book, or a hardcover. For international distribution, I think only
the hardcover. We tried it.
Yeah, only the hardcover. So
No. I got it on my Kindle.
Ori is hacking.
Oh, I just pressed Kindle.
And my website is susannahfox.com. I am constantly publishing new stories and trying to help people connect with each other, particularly rare diseases, on my blog.
Yeah, and I'll snitch. You have also a LinkedIn blog, which is great, where you write also and publish, and you can subscribe and get it to your email. And that's what I do. I think it's called Wow Health, right?
Yeah. Wow, how health. I decided I want to write something short that makes people say, wow. And then I tell them how these patients accomplished it.
So
thank you very much, Susannah. It was really insightful. Thank you, Ori.
Yeah, thank you, Liat. Thank you very much, Susannah, for your time. I'll end back in Hebrew, so excuse my Hebrew. תודה, ליאת.
תודה, אורי.
אם אהבתם את הפודקאסט הזה, ואם הוא נראה לכם חשוב, מאוד מאוד חשוב שתעבירו אותו הלאה ותחלקו אותו ברשתות חברתיות. תדרגו אותנו בחנויות הפודקאסטים ובפלטפורמות ב5 כוכבים, זה עוזר לנו להגיע לעוד אנשים. אם לא אהבתם, צרו איתנו קשר ונשמח לתקן. תודה רבה.